And another question, I think we have about 2 minutes. This is a question that puzzled me initially as my first looking at. Now I think I know what you say. Does the age of the patient influence the accuracy of the liquid biopsy? For example, is the liquid biopsy more accurate in the younger patient? And to build on that question, what makes the liquid biopsy more accurate?
I can just talk a little bit about the mutation. So, as the patient's age, we know from several studies, tumor suppressor genes, the mutations in those can happen with age. So P53 loss and others can happen with age. So when we are doing liquid biopsy on an aged patient, we may have, through the process of aging, they may have gathered certain mutations in the tumor suppressor genes. So whether they're true oncogenic or whether it's a process of aging, I think that's where some of the false positives can come in. So, I would like to say that age does add complexity when we try to look at the liquid biopsy results.
Yeah, I mean, I think you might be detecting smaller mutations that develop with time, like chip alterations that don't necessarily, or they're not actually influential in terms of your treatment at that time, but certainly contribute to the complexity, as you said.
Yeah, and I think what we know, what makes liquid biopsy more, not valuable, but more reliable is the disease burden. That's what Dr. Mark said. And I think, again, non-medical analogy, right? So if I completely owe that analogy to Dr. Molly Lee from Hong Kong. So if you are fishing and you put the rod in and you didn't get anything, that doesn't mean that there is no fish in the sea. So it just means that you're either a bad fisherman, meaning using a wrong test, or there is not enough fish in the sea to get it on your rod. So that's how you think about the biopsy. Negative liquid biopsy does not mean you don't have fish in the sea.